to understand this and all these fractures and all these problems, you need to understand this. A basic hand x-ray. We have just done a live tutorial for members on several different x-rays, looking at different problems, looking at different hand injuries, including some nasty fractures. That's in our members only area. You can click the membership button if you want to learn those exclusive clinical cases. This is our free session for non-members. And today we are covering something which has been a common theme of my clinical week, which has been fractures and hand trauma. So let's get into it. We want to look at the basics. So this is a hand x-ray. We can look at some basic anatomy and naming of things. So you've got 4 fingers, 1 opposable thumb. It's opposable because it does this. The fingers have 2 functions, flexion and extension. Let's start with naming. So here you can see the fingers. This is an adult hand. The metacarpals, we call these also phalanxes, metacarpals, and then the distal carpal row. If we start from the bottom up, you have the trapezium, the trapezoid, the capitate, the hamate, and the hook of hamate. Then we've got the metacarpal 1, 2, 3, 4, and 5. And then some differences between the thumb and the fingers. So with the thumb, you only have 2 phalanxes. We call it the proximal phalanx and the distal phalanx. For the fingers, you have 3 phalanxes. We call them the proximal, the middle, and the distal phalanx. Why is the importance of that? Because you have joints between them. For the thumb, it's only got 2 phalanxes, so you call it, there's only 1 joint. This is the interphalangeal joint, the IPJ. For the fingers, you have a proximal interphalangeal joint and a distal interphalangeal joint. Proximal, proximal, proximal interphalangeal joint, distal, distal, distal interphalangeal joint. The only other joints we haven't mentioned would be this one, and these are the metacarpal phalangeal joints, or the MCPJs, and each finger and thumb has one. And then there's another couple of joints you need to be aware of. You have the mid-carpal joint between the distal row of carpal bones, which is these ones, and the proximal row, so the mid-carpal joint. And then you have the radial carpal joint between the radius and the proximal row, the radial bone and the proximal row of carpal bones, and the distal radial ulnar joint. So distal radial ulnar joint, radial carpal joint, mid-carpal joint between the carpal bones. A really important joint is this one between the trapezium, trapezoid, and to the scaphoid, number 1, and then the trapezium and the first metacarpal. If you get lots of arthritis, you can tend to get it around this joint between the trapezium and the first metacarpal. Our next joint being the metacarpal phalangeal joints, the interphalangeal joint, proximal interphalangeal joint, and the distal interphalangeal joints. This doesn't have a proximal or distal because it only has 1 joint in the thumb itself, whereas the fingers have 2. Clinical relevance. On the flexor side of the fingers and the thumb, you have flexor tendons. So on the thumb, you have the flexor pollicis longus that inserts onto the palmar side of the distal phalanx. It comes from the radius, the radial bone. It inserts into the distal phalanx to flex the thumb. On the fingers, you have two tendons that insert. You have the flexor digitorum superficialis, the FDS, that flexes the proximal interphalangeal joint. And then you have the distal interphalangeal joint flexed by the FDP. That's the same for all fingers. So for the thumb, it's the FPL. For the fingers, it's the FDS for the proximal interphalangeal joint, and the FD. Let's do that again. The FDP for the distal phalanx. That's my doctor writing. Well, a good ad for that, is it? So that's important. You have some, so these are extrinsic tendons because they arise from outside of the hand, but within the hand you also have intrinsic tendons coming from intrinsic muscles that arise in the fingers. So the other structures you need to know about would be the lumbricals. The lumbricals flex the metacarpal phalangeal joints and extend the interphalangeal joints of the fingers. So they work with the flexors and extensors of the hand. And then you have the extensors on the back of the hand. So the flexors are on the front, the extensors are on the back. The reason why it's important to know about where these structures are is because if you've got an injury, you need to think about what's going to be compromised. If you've got a fracture through the base of the phalanx, a fracture through the base of this phalanx, you need to think about these structures being injured. So when you're testing the patient, you want to test if they have function, as well as sensation. You have nerves and arteries running on both sides of the finger. The other set of neurovascular structures you need to be aware of will be the ulnar artery and the radial artery. The ulnar artery, despite being able to feel the pulse of the radial artery more easily, so when someone does a pulse check, you check here because it's against a bony prominence, the actual dominant supply to the hand is from the ulnar artery, so not the radial artery. So for most patients, the ulnar artery is the dominant blood supply to the hand. That runs, it is quite handy, that's a pun, I just got it. The ulnar artery runs on this side of the hand, so not the thumb side, the little finger side, by the hook of hamate. Why is that important? Because if you've got fractures around here, if you have an injury which is where the bones are significantly spread apart and displaced, you've had a significant injury to this area, you need to check, you need to ensure that the hand has got a good blood supply, because you could have also injured the main blood supply to the hand. So that is your essentials for hand x-rays. We've talked bones, joints, and some structures. And the importance of that purely comes down to when you have injuries like this, where you have several metacarpal fractures, you've got displaced carpal bones, so that's the proximal row, scaphoid, lunate, triquetrum, pisiform, and then your distal carpal row where they're all displaced, and significant fractures of the metacarpals. There's a sesamoid bone, it's meant to be there, and some wear and tear arthritis, or for example when you have injuries like this. So if you want to know how we go through and assess fractures like this on an x-ray, and how we decide the diagnosis of what's the wrong and what we do about it, where you've got an off thumb off the base of the trapezium, you need to become a member, where we go through this live and you can watch it back. Until next week, have a good evening, and we'll see you in the members only area.